Every day, Asma Al-Sabag goes to work and gives people bad news.
Hi, I'm calling from Mariella.
And I'd say, I'm calling because you were recently exposed to someone who tested positive for COVID-19.
Al-Sabag is one of nearly 500 contact tracers working for San Diego County. It's her job to find and notify people who were likely in contact with someone who's tested positive for the coronavirus.
They have to monitor their symptoms twice a day. They have to check for fever. We go through the whole list of symptoms. There's like fever, difficulty breathing, cough. There's a whole list that we go over with them and we send them out to them too. We encourage them not to do things like share utensils or share bedding, to wear face covers around each other.
Al-Sabag estimates she's made hundreds of phone calls, but all her hard work may not be having the desired effect. Cases have been surging in the county, with daily counts approaching 500 and the total tally over 15,000. Yet the county's contact tracers have only reached about 9,000 county residents who are identified as a close contact of someone with the virus.
The last time they were within 6 feet without a face covering for longer than 15 minutes.
Plus, the county does not know how many of the people contacted actually followed the public health order and went into quarantine.
It's turned out to be much more difficult to standardize across the state.
Andrea Lacroix is an epidemiologist at UC San Diego.
And to sew together from various institutions and make it happen.
She and other epidemiologists say a regime of widespread wearing of face coverings, social distancing, testing, and contact tracing is the only safe way to slow the spread of the disease until a vaccine is available.
So I'm going to go ahead and give you a follow-up call at the end of your quarantine period, so that'll be June 14.
Back at her desk, the contact tracer Al-Sabag is working the phones again.
We're going to go ahead and release you. Does that sound okay?
9 out of 10 times the person's like, yes, I already know who it is. It's so-and-so.
That's because the person with COVID-19 is a family member or close friend. But other times, she's greeted with real anger.
They refuse to even listen or complete the interview until you tell them who the person, who infected them or who they were exposed to was, and we can't do that.
This is just one of the limitations on a contact tracer's power. They're not reaching all the people they need to reach. They can't force the people they do reach to give them information, and they can't force those who've been exposed to stay home. Jeff Johnson, the head of the county's contact tracing program, acknowledges the limitations.
If they are threatening to go to work, then we will have to talk with them and kind of advise them otherwise.
If a person does develop symptoms or test positive for COVID-19, the county then has the authority to force that person into quarantine. And if the person refuses,
we have somebody from the county, in some cases, has been a sheriff's officer, actually physically issue it. And like I said, that's been very, very rare.
Okay. Do you have any loss of smell or taste?
As for Al-Sabag, she plans to continue going to work and helping people through the challenging phone calls they received.
Until contact tracing is no longer a thing, probably when a vaccine comes out, I'm guessing.
Claire Tregesser, KPBS News.